Hello guys, welcome to the whiteboard lab. In this lecture, we will be learning about nephrotic syndrome. Kindly watch my lectures on nephrotic syndrome and follow the nephrotic syndrome along with it so that you will have a better understanding. So what is nephrotic syndrome? Nephrotic syndrome, there will be derangement in glomerular capillary walls which results in increased permeability to plasma proteins. In nephrotic syndrome, we have derangement in glomerular capillary walls. Okay, there will be derangement in the glomerular capillary walls resulting in increased permeability to the plasma proteins. So this is the basic definition of nephrotic syndrome. Alright, there will be derangement in the glomerular capillary walls which results in increased permeability to the plasma proteins. Now let's look at the components of the nephrotic syndrome. Components of nephrotic syndrome. So this is how you usually remember the nephrotic syndrome. Let's look at the components. So what are the different components we have? Number one is called as the massive proteinuria. Massive proteinuria. What will be the proteinuria range in nephrotic syndrome? So it will be usually more than or equal to 3.5 grams per day. So this is about the massive proteinuria. The second component in nephrotic syndrome we have is hypoalbuminemia. Hypoalbuminemia. The albumin of plasma concentration will be reduced. That is usually with plasma albumin levels of less than 3 grams per deciliter. The third component is generalized edema. Generalized edema of the patient. This will be mainly due to sodium and water retention. Along with this is also contributed by the hypoalbuminemia, which leads to reduced oncotic pressure and pulling of the water. And the fourth component is hyperlipidemia along with lipiduria. So these are the four components of the nephrotic syndrome. We have massive proteinuria, usually more than 3.5 grams per day, along with hypoalbuminemia, when the plasma level of albumin will be less than 3 grams per deciliter. The patient will also have generalized edema. This is mainly due to sodium and water retention, along with hypoalbuminemia also contributing to it. Patient will also have hyperlipidemia as well as lipiduria. Why do you think there will be generalized edema? Let's look at generalized edema. This is because of compensatory secretion of aldosterone. Why is there aldosterone secretion? This is because of hypovolemia induced renin secretion. This is the major one contributing to it. The second reason is there will be activation of the sympathetic system. Because of hypovolemia. The third reason will be there will be reduced ANP, atrial natriuretic peptide. So this ultimately leads to soft pitting edema of the patient. This will manifest in the form of periorbital edema, periorbital region. Along with this, edema will also be present in the dependent portions. If severe enough, this will also lead to pleural effusion pleural effusion along with ascites. Alright, so there will be generalized edema of the patient. This is mainly due to compensatory secretion of aldosterone because of hypovolemia induced renin secretion. There will also be activation of sympathetic system and also reduced ENP levels. This leads to soft and pitting edema in the periorbital region as well as the dependent portions. If this is severe enough, it will lead to pleural effusion as well as ascites. Now let's why is there hyperlipidemia and lipiduria in the nephrotic syndrome patient? Let's look at that. Why there is hyperlipidemia? Okay, the number one reason will be there will be increased synthesis of lipoproteins in the liver. Increased synthesis of lipoproteins in the liver. Okay, the second reason will be there will be abnormal transport of circulating lipid particles. There will be abnormal transport of circulating lipid particles. Okay, the third reason will be there will be decreased lipid catabolism. Decreased lipid catabolism. So combining all three, this leads to increased levels of cholesterol along with LDL, HDL will be reduced and increased will be VLDL. So this will be the ultimate outcome. The patient will also have lipiduria. This is because of glomerular leak, because of increased permeability. That's why glomerular leak. And in the urine you can see oval fat bodies. In the urine microscopy you will see oval fat bodies. Urine routine microscopy. So this will be the reason why there will be hyperlipidemia in a nephrotic syndrome patient. What will be the common complications? Common complications associated with nephrotic syndrome. Number one, the patient will have increased vulnerability to infections. Increased vulnerability to infections, mainly due to staph as well as staphylococcus as well as streptococcus. Why this is happening? Because of due to loss of immunoglobulins in the urine. Because of increased glomerular leaking, immunoglobulins will be lost in the urine. This will lead to reduced hypoimmunoglobulins in the blood. This will lead to increased infection. The patient will also have thrombotic and thromboembolic complications. Thrombotic and thromboembolic complications. Okay, this will be due to loss of endogenous antithrombin 3. Antithrombin 3 will help in reduced thrombotic complications, and whenever there will be loss of antithrombin 3 because of the leak in the urine, this leads to thrombotic and thromboembolic complications. The patient can also have renal vein thrombosis. If severe enough, the patient can have renal vein thrombosis. Okay, now let's look at the causes of nephrotic syndrome. Okay, coming to causes of nephrotic syndrome. Causes of nephrotic syndrome. Okay, we have primary as well as the secondary causes. Let's learn about primary glomerular causes. primary glomerular disease. Then this can also occur in whenever the patient has some systemic diseases. Okay. Coming to primary glomerular diseases, the first one is membranous nephropathy. Membranous nephropathy. The second one is minimal change disease. Minimal change disease, in short MCD. Okay. The third one is FSGS, that is focal sclerosing glomerulosclerosis, FSGS. The fourth one is MPGN, that is membranoproliferative glomerulonephritis. While others, it can be nephrotic as well as nephrotic, such as IgA nephropathy. We have a separate lecture on IgA nephropathy. Kindly make sure to watch that. So these are the primary glomerular diseases, that is membranous nephropathy, minimal change disease, focal sclerosing glomerulosclerosis, FSGS, MPGN, membranoproliferative glomerulonephritis, as well as IgA nephropathy. The nephrotic syndrome can also occur in the background of systemic diseases such as diabetes, amyloidosis, the patient suffering from SLE, that is systemic lupus erythematosus. It can also be certain drugs induced, such as the NSAIDs, heroin, etc. It can also occur in the background of infections, as we also know that malaria, syphilis, HIV, Hep B, Hep C, anything can be caused. Then it can also occur in the background of malignancies such as lymphoma, and it can also occur in the background of some miscellaneous conditions as well. So it could be hereditary nephritis. Okay. So these are the causes of nephrotic syndrome. It could be primary glomerular disease such as membranous nephropathy, minimal change disease, FSGS, MPGN, as well as IgA nephropathy. It can occur in the background of systemic diseases such as diabetes, amyloidosis, SLE, drugs induced in the case of NSAIDs and heroin, infections such as malaria, syphilis, HIV, hepatitis B and hepatitis C. So in the background of malignancies such as lymphoma and miscellaneous causes, that is hereditary nephritis. So this will be the basics of nephrotic syndrome, its complications and why the components and why is it occurring. We'll have a separate discussion of each topic, that is membranous nephropathy, minimal change disease, FSGS and MPGN, in the upcoming further lectures. Thank you for watching, guys. Move on to the next lecture and learn more about it. Thank you.